The Democratic Republic of Congo continues to battle a worsening Ebola outbreak as regions controlled by the M23 rebel group have introduced strict containment measures in eastern Congo. Authorities in the rebel-held areas have imposed a mandatory 21-day quarantine for all people arriving from Bunia and Ituri provinces in an effort to curb the spread of the virus. Provincial Health Director says screening procedures have been strengthened, especially at checkpoints across North Kivu. And according to officials, no one is being allowed to enter the city of Goma without first passing through a quarantine facility in Kanyaruchinya. The World Health Organization says more than 900 suspected Ebola cases have now been identified across the country, including 101 confirmed infections. World Health Organization Director General says surveillance efforts have been significantly expanded as health authorities race to contain the outbreak. The World Health Organization has also declared the outbreak of the rare strain of Ebola a public health emergency of international concern. The agency warns that delayed detection, the lack of a vaccine or virus-specific treatment, ongoing armed violence and frequent population movement are increasing the risk of wider transmission. Health officials have confirmed one probable Ebola-related death in South Kivu since the latest response operation began. Following the death, authorities traced and identified several people who had been in contact with the victim and placed them under medical monitoring. Officials say one of those contacts has since tested positive for Ebola virus disease. Eastern Congo now has remained under control of M23 rebel forces for more than a year, and despite the conflict, the Congolese government and rebel groups are now communicating through international mediators, including the United States and Qatar, to coordinate efforts against the Ebola outbreak.